Welcome back to Pharma-Logic, where medicine meets meaning, and we crack open the black box of confusing health advice using actual science and a little common sense. Today's big question: is the biggest killer in the world actually avoidable? Spoiler alert, kinda yes. But the truth, like a triple-decker cheeseburger with a diet soda, is more complicated than it looks. Today we're talking about heart disease, specifically heart attacks and high cholesterol, the gruesome duo that still reign as the #1 cause of death in the US and worldwide. So if you're thinking, wait, didn't we already conquer heart disease with all those heart-healthy cereals and statins? Well, not quite. Let's break it all down. What actually is heart disease? When people talk about heart disease being the leading cause of death, they're usually talking about atherosclerotic cardiovascular disease. That's a mouthful, but it basically means your arteries, especially the ones feeding your heart, are getting clogged with plaque. Plaque isn't some mysterious goo. It's made of fat, cholesterol, calcium, and other things floating in your blood that decide to settle into your artery walls like unwanted squatters. Over time, this gunk narrows the arteries, restricts blood flow, and eventually causes, you guessed it, heart attacks. Let's talk heart attacks. A heart attack, aka myocardial infarction if you want to sound fancy, happens when one of those plaque-filled arteries gets completely blocked. Blood can't reach a section of the heart, and that heart tissue starts to die. Unless it's treated quickly, that damage is permanent. And yes, sometimes fatal. Some people imagine heart attacks as a dramatic chest-clutching moment, but for many, especially women, the symptoms are sneakier. Fatigue, nausea, shortness of breath, or pain in the jaw or back might be the only signs. That's part of what makes heart attacks so dangerous. They often strike without warning, and not everyone gets the Hollywood version of symptoms. But why are we still seeing so many heart attacks when we've known about cholesterol and diet and exercise for decades? Let's talk cholesterol, the misunderstood villain. There are different types of cholesterol, and not all of them are bad. Your body actually needs cholesterol to build cells and produce hormones. The problem is when you've got too much of the wrong kind, specifically LDL cholesterol, low-density lipoprotein. LDL is the one that contributes to plaque buildup in your arteries. HDL, high-density lipoprotein, on the other hand, is often called good cholesterol because it helps remove LDL from the bloodstream. Think of HDL as the janitor and LDL as the glitter your arteries wish they never saw. When LDL levels get too high, from genetics, diet, or lifestyle, your risk for a heart attack increases dramatically. Why high cholesterol is sneaky? High cholesterol has no symptoms. You can be walking around feeling perfectly fine while silently collecting cholesterol deposits in your arteries like it's a game of arterial Tetris. That's why regular blood tests are so important. A standard lipid panel will tell you your total cholesterol, LDL cholesterol, the bad stuff, HDL cholesterol, the good stuff, triglycerides, another type of fat in your blood. What causes high cholesterol and heart attacks? Let's bust the myth that heart attacks only happen to people who eat fast food for every meal. That's simply not true. Here are the biggest contributors. Genetics. Some people inherit familial hypercholesterolemia, a condition that causes very high cholesterol levels from a young age. You could be jogging daily and eating salad and still have sky-high LDL. Diet. Saturated fats, trans fats, and excess sugar can increase LDL cholesterol and triglycerides. Processed foods, red meat, and sugary snacks all add up over time. Lack of physical activity. Exercise increases HDL cholesterol and helps clear out LDL. Being sedentary lets the bad stuff pile up. Smoking. Smoking damages blood vessels and lowers your HDL levels. Double whammy. Diabetes and obesity. High blood sugar contributes to inflammation and damaged arteries, both of which speed up plaque formation. Stress. Chronic stress increases cortisol, blood pressure, and inflammation, all of which are enemies of your heart. Let's bust a few more myths. Myth number 1. I'm not overweight, so I'm fine. Sorry, no. Even lean people can have high cholesterol, high blood pressure, and heart disease. Thin doesn't mean healthy. Myth number 2. I'll feel it if something's wrong with my heart. Nope. Many people don't realize they're at risk until they end up in the ER. Heart disease can be completely silent until it's not. Myth number 3. Only old people have heart attacks. Wrong again. Heart attacks can and do happen in people in their 30s and 40s, especially if they have risk factors like high LDL or smoking. Myth number 4. I'm taking a statin so I can eat what I want. Statins lower cholesterol, but they don't cancel out a poor lifestyle. You still need a healthy diet and regular exercise. Medication isn't a free pass. So, can we actually prevent heart attacks? Yes. Heart disease isn't 100% preventable, but up to 80% of cardiovascular events, including heart attacks, are considered preventable through lifestyle and medical management. That's a massive opportunity. Here's what prevention looks like. 1. Know your numbers. If you haven't had a lipid panel recently, ask for one. Adults over 20 should have their cholesterol checked every 4 to 6 years, more often if they have risk factors. 2. Eat like you care about your heart. Prioritize fiber-rich foods. Veggies, fruits, whole grains, legumes. Limit saturated fats found in butter, cheese, red meat. Cut out trans fats entirely. Reduce added sugars. Try the Mediterranean diet. It's been shown to reduce heart disease risk. 3. Move your body. Aim for at least 150 minutes of moderate intensity exercise per week. That's just 30 minutes a day, 5 days a week. Walking counts. So does dancing, swimming, or chasing your dog around the yard. 4. Manage stress. High stress and high inflammation equals bad news for your arteries. Mindfulness, therapy, hobbies, social connection. Find what works for you. 5. Sleep well. Poor sleep is linked to increased LDL, higher blood pressure, and weight gain. Aim for 7 to 9 hours of quality sleep per night. 6. Don't skip medications. If your doctor prescribed a statin or other cholesterol-lowering drug, take it. These meds reduce the risk of heart attacks by stabilizing plaques and lowering LDL. 7. Consider coronary calcium scoring. This is a CT scan that checks for calcium deposits in your coronary arteries. It's especially helpful for people with intermediate risk who want a clearer picture of their heart health. What about supplements? Fish oil, niacin, red yeast rice? You've probably seen a million heart supplements. Some may help, but they're not a substitute for medication or lifestyle. Talk to your pharmacist or doctor before starting anything new. Some supplements interact with prescription meds or aren't as effective as advertised. And yes, some over-the-counter items like plant sterols and soluble fiber can help, but only if you're also making consistent lifestyle changes. Final thoughts. Heart attacks don't usually come out of nowhere. They come after years of silent damage, from high cholesterol, from poor habits, from things we ignore because they don't hurt yet. But that's the good news. Because heart attacks often come with warning signs in your labs and lifestyle, they're often preventable. You can lower your cholesterol. You can improve your diet. You can move more, smoke less, stress less, and sleep more. These aren't magical changes. They're manageable ones. If you've had a family member affected by heart disease, or if you just want to make sure you're not part of the 700,000 who die from it each year in the US, start today. Not with a fad diet or expensive program, but with simple, steady changes. Talk to your pharmacist. We can help you understand your numbers, your meds, and your options. And we'll do it without judging your snack drawer. If this episode helped you rethink heart health, hit that subscribe button for more pharmacist-backed health insights every Friday at 5 p.m. Mountain Standard Time. Got questions about cholesterol, heart attacks, or lifestyle changes? Drop them in the comments. I'd love to hear from you. This is Pharma-Logic, where medicine meets meaning and where your heart finally gets the attention it deserves.